help take care of our frail elders are required to be certified in order to work. The training and testing for certification are given in only 6 languages, including English, Spanish, Russian, Cantonese, Korean, and Vietnamese. This means that many home care workers who speak Cambodian, Laotian, Tagalog, Samoan, and many other languages, who take care of clients who speak the same languages, will not be able to be certified. This is creating a crisis in home care services for the elderly in such communities and communities of color like the Asian Pacific American communities. What would you do to address this problem?
Well, this is a very important issue to make sure that our home health care workers can have a close working relationship with their clients. I just spent a good part of a day with a home care worker named Sherry in Renton, with one of her clients who had an amputated leg, and understood how important it was for Sherry to be able to have good communications with her client. This home health care is really the meaning of dignity, to be able to assure that people can remain in a stable situation in their own home. And if we're going to make sure that this home health care works, we have to make sure that these workers can in fact converse and communicate with their clients. Now, we are a very diverse state. I was a little bit reminded of that. I was talking to a friend, and he passed on our good wishes from a guy named Bob Underwood, who's president of the University of Guam. And we were talking about the Chamorro community and the language that is spoken. We have incredible diversity in this state, and if we're going to serve a diverse population, we have to have a diverse way for these folks to communicate. Now, that's one of the reasons I voted for Initiative 1163, to make sure that we have adequate training for our home care workers. These are some of the hardest working people, including the members of SEIU, some of them who are here today, to make sure that we can provide these provisions. So I look forward to moving forward to improve those interpretive and that language training.